Welcome to your guided preparation for a respiratory therapist interview. Whether you're a seasoned professional or just starting out, we're here to help you shine. Let's dive right into the first question you might encounter, focusing on how you can demonstrate your teamwork skills effectively. Can you share an experience where you worked closely with a healthcare team to enhance patient outcomes? This question is all about showcasing your ability to collaborate effectively in a healthcare setting to provide the best care for patients. Let's go over some key points to consider when answering this question. Recall a specific instance that highlights collaboration. Detail each team member's role in achieving the goal. Explain the steps you took together to improve the patient's condition. Discuss the outcomes and how these were measured. Highlight your personal contribution to the team's success. Now, let's look at how you could frame your answer.
In a recent case, I worked alongside nurses and physicians to manage a patient experiencing a COPD exacerbation. We crafted a coordinated care plan where I focused on providing respiratory therapy while the nurses managed medication adjustments. Our combined efforts led to a marked improvement in the patient's breathing, allowing for an earlier than expected discharge.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for respiratory therapist. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a challenging case you handled and how you approached it. This question is your opportunity to demonstrate problem-solving abilities and showcase your critical thinking in complex clinical situations. Here's how to tackle this type of question. Select a specific case that showcases your skills and problem-solving prowess. Clearly describe the patient's condition and the challenges you faced. Walk through your thought process and actions taken to resolve the issue. Include any collaboration with other healthcare team members or family. Share the outcome and what you learned from the experience. Let's see a sample answer to get you started.
I once had a patient with severe COPD who wasn't responding to usual treatments. I took the initiative to reassess their needs and collaborated with the medical team to adjust ventilator settings. By introducing a new treatment plan, we significantly improved their oxygen levels, leading to a successful discharge. This experience taught me the importance of adaptability and collaboration in treatment.
Describe a time when you had to lead a team in a critical hospital situation. With this question, the interviewer wants to understand your leadership abilities and how you handle high-pressure situations. Consider these points as you prepare your answer. Choose an instance where you took charge. Emphasize the urgency and critical nature of the situation. Outline your role and the actions you took to lead the team. Talk about the outcome and the positive results of your leadership. Reflect on the lessons you learned from the experience. Here's an example to illustrate how you might respond.
During a severe asthma attack in the ER, the team was overwhelmed. I quickly assessed the situation, delegated tasks, and directed the team to prepare nebulizers and administer oxygen. Thanks to our swift and coordinated response, the patient stabilized within minutes, and we refined our emergency protocols for future incidents.
How would you handle a situation where a patient refuses therapy? This question aims to assess your patient care skills and your ability to handle sensitive situations delicately. Here are some strategies for addressing this scenario. Listen to the patient's concerns without interruption. Show empathy and explain the importance of the therapy. Provide clear information about the benefits and potential consequences of refusing treatment. If suitable, involve family members to encourage compliance. Document the refusal and discussions thoroughly for future reference. Consider this example when forming your answer.
I would start by listening to the patient's reasons for refusing therapy, demonstrating that I understand their concerns. Then I'd explain the benefits of the therapy and potential risks of refusal. If it seems appropriate, I might involve their family in the conversation to support the decision-making process.
What steps would you take if a patient's oxygen saturation suddenly dropped while you were with them? This question evaluates your ability to respond promptly and effectively in emergency situations. Here's how to ensure you cover all bases when answering this question. Stay calm and assess the situation quickly. Immediately check the patient's airway and breathing. Administer supplemental oxygen if necessary. Alert the physician or a senior nurse about the drop. Document the incident and keep a close watch on the patient. Let's look at a sample answer to help frame your response.
If a patient's oxygen saturation suddenly dropped, I would remain calm and promptly check their airway and breathing. I'd administer supplemental oxygen as needed and immediately inform the physician. Close monitoring and thorough documentation of the incident would follow to ensure ongoing patient safety.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.